Hi, I am Dr. Akshat Pandey and welcome to IRACON TV. I am a practicing rheumatologist from Indore and today I am delighted to have Professor Vikas Agarwal who is from SDPGI Lucknow. How are you, sir, today?
Yeah, fine.
So, sir, how do you find this year's scientific program of IRACON 2023? Would you like to comment something on it and what interests you the most out of all the program?
Yeah, the scientific program is excellent. I can say this is a world-class program covering almost each and every aspect of rheumatology and rheumatic diseases. Not only that, I find it very interesting to see that most of the young rheumatologists are given great credit
Yeah.
for their scientific contributions, and they are one of the few important speakers in this meeting. And they are also presenting some very nice work, which is an eye opener, at least to me, because I was not aware of some of their work. And I find this scientific meeting to be of utmost importance and significance, at least to me. I hope it is so similar for everyone who is attending.
Of course, of course. You gave a talk on fibrosing and vasculopathy in scleroderma. So, could you share a few points about it?
Yeah, so scleroderma is a very frustrating disease in a way because most of the patients they present late, and by the time disease is well established, it's very difficult to at least give them expected response. But in last say around 15 years, a lot of things have actually improved. And so my whole idea of today's presentation was what all new is happening in the field of systemic sclerosis. The pathogenesis wise, it is the vasculopathy which begins the disease and followed by a lot of fibrosis of skin and the internal organs. And so I had reviewed the world literature and could find out some very important translational researches in last 1 year, like IVIG and agarwal mode, which are being used in animal models to improve fibrosis. And I shared our own center data on use of PD5 inhibitors, which are very well known, documented to improve vasculopathy, especially Raynaud's and other symptoms. And not only that, we shared our basic lab research work where we had been able to demonstrate PD5 inhibitor reducing fibrosis. So the message of my presentation was that patients who are having systemic sclerosis, if we can catch them early, then they should be sort of put on PD5 inhibitors as early as possible and should be continued despite having Raynaud's or not, because this molecule is working as a disease-modifying drug. And if we can catch patients early, there is a chance that we may be able to either prevent or reduce the existing fibrosis and vasculopathy in some of our patients.
Of course, of course. And so, nowadays, JAK inhibitors are readily available and people are using upfront in many autoimmune diseases, including rheumatoid and spondyloarthritis. So, any role of JAK inhibitors in scleroderma and in future?
Yeah, if you ask me a scientific rationale behind the use of JAK inhibitors in scleroderma, it is there. Why? Because interleukin 6 and 17, which are predominant cytokine, which I also showed in my presentation today, which drives the fibrosis. And we know JAK inhibitors inhibit the signaling of these two important cytokines. But having said that, because the molecule was approved by FDA for rheumatoid arthritis in the beginning and also now spondyloarthropathy, I just need to caution the young rheumatologists or the people who are using tofacitinib in many of the rheumatic diseases. Please be very careful because a lot of infections are a major problem with the use of tofacitinib. And also, one should be very careful in evaluating their patient for a possible risk of venous thrombosis, because that has also been shown to be increase in patients who are using tofacitinib. So, only future randomized controlled trials can actually give us an answer how good this molecule is, especially in disease like systemic sclerosis.
Yes, sir. So you have done a lot of work on stem cells, role of stem cells in autoimmune diseases. So would you like to throw some light on it and future?
Yeah, so actually my major work is only in osteoarthritis, where we have actually injected mesenchymal stem cells, bone marrow derived mesenchymal stem cells in osteoarthritis patients of having severity of grade 2 and grade 3. And the response was, I must say, it was not what we were actually expecting, like a regenerative medicine making a new cartilage and improving the cartilage thickness and also functionality. But what we realized was that patients had a long-lasting pain relief. Their mobility also improved. And we participated in one of the phase 2 studies, and later on phase 3 study has also been completed. And it has also shown the same results which were observed by us in phase 2 study. So there is a potential for use of these kind of stem cells in management of osteoarthritis. Again, most common arthritis world over, but we don't have any sort of treatment for these patients except in late stages we ask them to undergo a joint replacement.
Any takeaways from the recent EULAR guidelines on management of scleroderma?
Yes, actually now they have stratified all the treatment protocols, and though they do suggest that for especially for interstitial lung disease, one can choose between different immunosuppressive molecules, but which molecule to be chosen for which particular patient is still not clear. So that is left to the judgment of the or the experience of the treating physician, and also the patient profile, and also the autoantibody profile of the patient. But having said that, it actually gives a clear perspective to the physicians and the rheumatologists worldwide which all molecules should be used. And what I find was that nintedanib, which is probably not that being commonly used by us, at least rheumatologists, but much more preferred by pulmonologists, probably will find a more place in our day-to-day practice after these EULAR guidelines.
So you have done more than 250 research scientific publications. So, and that's a remarkable contribution to our fraternity. So would you like to give a message to a young rheumatologist related to the scientific publications?
I think research is actually driven by passion. So if you are passionate enough to share your contribution to the fraternity, your colleagues worldwide, then you need to publish. Gone is the era when we used to say that a physician has got this much experience on this particular disease, but then nobody is going to use it because nobody is going to experience the same experience what you have done. So it's better to share your results so that the world can find utility of your research.
That's some words of wisdom, sir. We were honored to have Professor Vikas Agarwal with us. Thank you so much, sir, for your time, and we wish you all the best.
Thank you.
Thank you.